we're going to hear first from Dr. Sean Lin. He is a member of the Committee on the Present Danger of China. He is a survivor of the Tiananmen Square massacre during his time in China. And since he left, he has been a prominent figure in certainly the work of this committee in bringing to light insights into what China is about, what it does to its own people, and what it aspires to do to the rest of us, in part informed by his experience as a practitioner of Falun Gong, a very, very harshly persecuted minority in China, its practitioners. He is also, by training, a PhD in microbiology, who served in the United States Army and completed his 9 years of service in the Army as the director of a viral disease laboratory at Walter Reed. We've asked Dr. Lin to share with us his insights with the experience of a trained microbiologist, specialist in viral diseases, to sort of give us a sense of what this disease is about, what it is likely to do in a nation like ours, and how best to counter it. And we're very pleased to welcome Dr. Sean Lin to this virtual threat briefing of the Committee on the Present Danger of China. Dr. Lin, over to you.
Thank you, Frank. Thank you for organizing this virtual threat briefing, a very important threat briefing, because as we know, in the last couple of weeks, there were a lot of debate because the Chinese government has been pushing out a big smearing campaign, blaming the US was the source of the virus outbreak, and even blaming US military spreading the virus to Wuhan, when US had a delegation to join in the military competitions, sports competitions in Wuhan last year. So I think this is really actually pissed off a lot of people in the military service. And I think it's a good time, let's look at what exactly happened in China in December and January, what Chinese government did and what happened in China regarding this outbreak. So we can now have more insights, know what's happening based on many of the media report and also on social media from Chinese press. So we can see now the first case can actually be traced back to December 1st. And this was actually based on a Lancet report by a Chinese doctor, Huan Chaoling, from the Wuhan Jintang Hospital, which is the main hospital that's treating these patients infected with novel coronavirus. And then on December 8th and 10th, 4 more cases already being hospitalized. And only one case actually associated with the Huanan seafood market. And then throughout December, more and more patients turn out hospitalized in different hospitals in Wuhan. And actually, some of the samples already being shipped to sequencing company to conduct pathogen discovery. And then by December 26th, the Guangzhou Weiyuan Genomic company has already obtained a full viral sequence and has already reported to the Wuhan CDC as well. And they mentioned they identify a SARS-like virus with 81% homology. So this clearly is a SARS-like virus. And then the Jintang Hospital also conducted many tests to confirm this is a SARS-like virus with additional sampling from the different patients. So this is actually already confirmed by December 30. This is a SARS-like virus, a novel coronavirus. But however, on December 30th, the Wuhan Public Health Commission, when they issued the public alert, they still saying this is an unknown pneumonia, right? And then on December 31st, the Wuhan police actually announced their punishment for the 8 doctors who talk about this identification of novel coronavirus on their own social chatting rooms on the WeChat. And Dr. Li Wenliang was one of them. And this is actually already, when the Public Health Commission already know this is a novel coronavirus. So on January 1st, BGI, one of the biggest genomic sequencing company in China, also obtained the full genome sequence and then submitted to the Chinese CDC. So it's very clear on January 1st, the Chinese authority know this is a novel coronavirus, but they still tell the public this is an unknown pneumonia, and they still punish those doctors who try to tell their colleagues about this outbreak of the novel coronavirus in Wuhan. And also including Dr. Ifen from Wuhan Central Hospital. She's the one actually sharing those CT images to her colleagues, telling about this is a novel coronavirus or SARS-like patients. So all of them got criticized and they got silenced. And so you can see Chinese government already wasted the whole month of December in response to this outbreak. And then on January, and the local government still did not take any active measures to prevent the disease outbreak. And even on January 17th and 18th, the Wuhan's local governments still organize big community events, and one of the events have more than 40,000 households with more than 100,000 people engaged. And this is actually when the Chinese CDC already announced their highest level alert on January 15. So it's really hard to imagine that the local authorities in Wuhan can have such high level of malfeasance in handling this disease. And also, we know the Wuhan CDC has also done a terrible job in the initial response to this outbreak. So far, we have not seen any report about the testing results for any animal sample might be collected in the Wuhan area or whether in the Huanan seafood market or not. But there's no report on any testing results for animal samples. So far, the whole world still don't know what would be the real animal reservoirs, and also no idea who may be the patient zero. The Chinese government still owed the whole of these key questions. And these are very important in terms of epidemiology. So what might be the animal host, what might be the intermediate animal host, because even if the wave of the epidemic passed away, the whole world still need to be alert what might be the animal host, what might still spreading the virus as through this intermediate animal host. So this is really, really important question, but the Chinese government still owe the whole world about these questions. And also, I think the terrible failure of the Wuhan CDCs and Chinese Public Health Commissions on identifying the patient zero and also the animal reservoir really should be held accountable, and also especially need to be held accountable when they're covering up the information and let the Chinese society missing a very golden about 1 to 2 months period to contain this outbreak. And we know there's a recent report on it's a preprint by the University of Southampton from United Kingdom. And this report is actually joined publication by many scientists from UK, from China, from the United States too. And this report clearly predicted if this outbreak can be handled by non-pharmaceutical inventions, through different measures like social distancing, even just 1 week, 2 weeks, 3 weeks earlier, the total case of infected in China could be dramatic difference. The number can be reduced to like 66% reduction, 86% reduction, or 95% reduction respectively, if the Chinese government can really be transparent and handle it with non-pharmaceutical invention 1 week, 2 weeks, or 3 weeks earlier. So this is clearly telling us the Chinese government is really the culprit for the outbreak that's spreading whole world to become a pandemic. They need to be held accountable. And so this is a clear scientific, suggestion that the Chinese government did a terrible job covering up, the situations. And right now they even try to shift the blame to the United States. And I think the whole world is actually paying the price for these Chinese government's malfeasance and also their corruption, their covering up the informations. And so this is very, very sad situation. One government's terrible mistake and the whole world have to suffer. And at the same time, we also need to ask about Chinese government's to have transparency regarding about their gain of function studies in their virology lab in Wuhan. Because the Wuhan Institute of Virology definitely have the capacity to conduct many of the gain of function studies, even based on the previous publication. For example, they already put a bad coronavirus S protein on a mouse adapted to human SARS coronavirus backbone. And the resulting viral mutants was actually, to their own surprise, gaining pathogenicities in the mouse models too. And I saw other reports saying these groups of scientists in the Wuhan Institute of Virology may already conduct studies on the rhesus macaque on some of the gain of function studies. But because maybe related to the military projects, and it's very hard to find out additional detail. So I think the Chinese government still also owing the world another explanation whether or not they have military projects already pushing on the gain of function study on coronavirus or other dangerous pathogens like Ebola virus. And the Chinese government signed up the Biological Weapon Convention on 1984, but do they really comply with this convention? So these another questions the Chinese government need to answer to the whole world, because it's really a fundamental bioethical issue, and the Chinese government's experiment on this front may put the whole humanity in danger as well. So I think this is really an important question as well. So overall, I feel right now, we saw that President Trump has been insisting calling the outbreak China virus, and also Chinese virus, and the Secretary Pompeo called this Wuhan virus. I think this is also a accurate description, because it described where the outbreak started, where it originated, and this is a common way in the scientific world as well to naming the disease based on where it originated. And at the same time, I think it's could be even more accurate to call it CCP virus as well, because it's the Chinese Communist Party's force to let the whole virus spread into the whole world, and it's like the CCP's curse on the whole world. So I think it could be even more accurate to call it CCP virus as well.